Hi, I'm Sami from Body and Birth Physiotherapy in Brisbane, and today I'm going to tell you what to expect at your first pelvic floor physio appointment. I'm going to start off straight away by letting you know that most people are nervous or a bit apprehensive before their first pelvic floor physio visit. This is totally normal and understandable, as it can be a very personal and private appointment, and I had the exact same feelings before my first pelvic floor assessment. However, most people leave by saying, well, that wasn't nearly as bad as I expected. Now, I can't say for sure what they expect, but I'm very happy to exceed expectations. As we are physiotherapists, first and foremost, the structure of a pelvic floor visit is very similar to your regular physio visit, with the main difference being that it's in a private room. First off, we get a detailed history of your current symptoms, including your past history of any injury or pregnancies, your pain and/or bladder and bowel habits, and this is then followed by a biomechanical assessment of your posture, gait, lower back, and pelvic and hip movements. As the patient, you are in total control of the entire session and do not have to give any information or undergo any assessment unless you are comfortable with it. However, both the history taking and the physical assessment components are important, as they help to give your physiotherapist clues about the possible underlying causes of your symptoms. It also allows you to become much more comfortable with your practitioner. At this stage, your physio may discuss some of your symptoms in further detail or hypothesize as to what might be contributing to your problem. I generally explain my thought process along with the anatomy and function of the pelvic floor muscles and the pelvic organs, using helpful diagrams or models like Patty. With your consent, we would then proceed with the specific assessment of the pelvic floor muscles. This allows me to assess the strength and function of the muscles. Are you able to fully contract and relax your pelvic floor? What's the control and the coordination like between all of the muscles? What is the tension or the underlying tone of the muscles like? And we can also check to see if there's any indication of prolapse, scarring, restrictions in the tissue, or any neural sensitivity. The internal assessment is generally done via the vagina with just gloved fingers and some gel, no speculums required, and does definitely not have to happen on the first visit unless you feel comfortable. I tend to leave the room while my patients get changed, and you would generally take off everything from the waist down, lie down onto the table, and then have another towel or sheet covering your lap. When I come back in, I explain again the different parts of the assessment and only ever proceed with the internal with your full consent. This assessment can, of course, vary just depending on the patient's need and then the therapist. Some pelvic floor physiotherapists do tend to use probes or devices and computers to measure the activation of the pelvic floor muscles, or with an external ultrasound via the abdominal wall. Personally, I feel like I can get a much clearer impression of the individual muscles contracting, any restrictions, and the muscle tone by just using fingers to palpate. I always emphasize to my patients that if you feel unsure or uncomfortable with the process at any point, please let me know and we can either stop or modify the assessment as needed. Remember, you are always in complete control of the visit. Education and exercise does form a huge part of my treatment approach, as I feel like I'm best able to help you learn how to heal yourself by teaching you how to move better and to move more effectively to facilitate good pelvic floor health. However, it is sometimes helpful to do some specific retraining of the pelvic floor muscles while I can give you some feedback at the same time. And sometimes manual therapy can be helpful as well, to release some of the tightness in the muscles. And as I have a completely paperless office, I don't provide any handout sheets. However, I do email you out a brief summary of your assessment and a list of things that I would like you to practice or work on at home, and then some specific exercises as well. After any appointment, I'm always available to answer questions via email or over the phone. And there you go. You have just survived your first initial visit and assessment with a pelvic floor physio. And you can keep in mind that most pelvic floor physios have undergone similar assessment and treatments, so we do have empathy for your situation. You can't just learn these things from a book. So when you're making that call and booking that appointment for an initial assessment or consultation, don't be nervous. You know that you're in the good hands of somebody who understands your perspective. If you are in need of an assessment, please feel free to call Body and Birth if you're local to Brisbane or Queensland, or have a search online to find one near you. You can also check out the link below to find some reliable ways of finding a specific women's health or pelvic floor physio. I hope you found this video helpful and that it eased any worries that you may have had. If so, please subscribe, comment, or share, as there will be more info to come. Thanks!